Kiss.
Okay, so the name of my drug is Minoxidil. Here's the structure. Its molar mass is 209.251 grams per mole. It is C9H15N5O. So its treatment is for hair loss. It's the safest and most effective, only FDA-approved product for androgenic alopecia, which is the most common dermatologic problems worldwide, and characterized by progressive hair loss, especially on the scalp. Some brand names for it are Rogaine, Lonaten, and Renewal. And the only historic alternative I could find was hair follicle transplant surgery, and that's today it's only recommended if topical minoxidil isn't effective. So it was originally developed in the 1950s by the Upjohn Company as a treatment for ulcers. So they did this on dogs, and they found that it decreased blood pressure. So then they decided to get permission from the FDA to test it as a medicine for hypertension, which is high blood pressure. And in these tests, they found that it caused increased hair growth in the patients. And so the researchers decided to try to make a topical solution that could be applied to the balding scalps. And in 1988, the FDA approved the drug under the name Rogaine. And in 1996, the patent expired so that it could be sold off-brand, over-the-counter, and by different brand names. So pharmacodynamics, so it's the relationship between the drug concentration and the site of action and the resulting effect, including the time, course, and intensity of therapeutic and adverse effects. So this is based off of a single trial, so a multi-center trial involving approximately 2,000 subjects with male pattern baldness reported that topical minoxidil 2% or 3% lotion applied twice daily for 1 year produced cosmetically acceptable hairy growth in about 1/3 of those treated. So some adverse effects reported in the clinical trials were dermatological reactions such as itching, scaling, flushing, and rarely allergic contact dermatitis, and also temporary hair loss is a common side effect. So some of the companies say that you have to shed the hair and then regrow new hair, something like that. So the pharmacokinetics, it's defined as time course of drug absorption, metabolism, and excretion, and this is also based on a single test. So this is following topical application of 1% or 5% lotions. The commercially available preparations for the 2% lotion reveal the low level of percutaneous absorption, and serum concentrations very rarely exceeded 5 nanograms per liter, and not nanograms, micro. After single application of following 9 days treatment with minoxidil lotion, 1% or 5% less than 5% of the administered dose was recovered in the urine, and none was found in the feces. So the mechanism by which minoxidil produces hair growth is not fully understood. It is hypothesized that minoxidil widens blood vessels and opens potassium channels, allowing more oxygen, blood, and nutrients to travel to the hair follicle, and this may cause follicles in the resting phase to shed and be replaced by follicles in the active growth phase. And it's converted, so it's a super drug, I think that's what it's called. And yeah, it's a prodrug, not a super drug. A prodrug, and it's converted to its active state, minoxidil sulfate, by sulfation via the sulfotransferase enzyme, SULT1A1.
What is considered cosmetically acceptable hair?
I was thinking the same thing. The 1/3 kills me too. It's like after all that work, only 1 in 3 people actually got use from it.
I don't know. It's probably just biased on what the researchers assume.
So they go from Nottingham to Chase.
Right.
Why does a company called Upjohn Company produce hair for like getting hair back instead of erectile dysfunction?
Yikes. True.
Oh, Upjohn Company, come on.
It's fair. It's a fair question, Chase.
Oh my god.
You should like,
This book is made on the internet.
I think now it's the,
How to be
I
alive.
don't know, how do you pronounce it? P-F-I-Z-E-R? Pfizer?
Pfizer.
Pfizer, that's what it is now.
Things that go on with people.
I have-
Really appreciate.
I have two. One, you touched on something that is really common among drugs, and that's what is a prodrug.
It's a prodrug is a compound that undergoes biotransformation before exhibiting pharmacological effect.
Okay, what does that mean?
I'm not sure. I guess you have to like transform it in some way before it can actually be used as like medicine.
Basically, and so a really good example of a prodrug, and I don't know one specific off the top of my head, but there's a lot of things that, for example, get destroyed in your stomach because of all the acid. And so there's prodrugs that you take them, they are not acid sensitive, okay? And then once they get absorbed into the lining and they get into the blood, then whenever some part of it gets cleaved off by an enzyme and now it's useful in your body. But if you had just given it without that thing on there to protect it, it would have just gotten eaten up by your stomach acid.
Like
So-
synthesized DMT.
but sure, synthesize, I guess. I don't know enough about DMT to
I talked about in my presentation, like whenever they like burned up those vines, there's like something in there that like helped you digest it, or whatever you want to say.
sure. What's flushing?
Flushing?
Yeah.
Yeah, that was one of the side effects.
Or was
I know what it is, but I have a funny story about flushing.
probably just like redness of skin,
Yeah,
like
that's what it is.
inflammation.
That's what it is. So we used to watch